A very common concern of parents, the baby's a couple of days old and it's yellow, and the pediatrician is starting to check a thing called a bilirubin. What is that all about?
When the baby is born, one of the changes that occur in his body is that he starts to break down some of the fetal hemoglobin that is the type of hemoglobin that circulates in his red cells while he's developing as a fetus. The breakdown of this bilirubin, hemoglobin will create a pigment called bilirubin that at very high levels is potentially toxic to the brain. Inside the womb, while the baby is developing, the placenta is actually doing the filtering and the cleaning and the picking up of this waste product that gets excreted into the baby's gut or back into the mother's circulation. Once the baby is born, in essence, the liver of the baby needs to pick up that bilirubin and dispose of it. There may be sometimes a delay in the liver's ability to do that. And when that happens, some of this pigment will accumulate in the baby's circulation, giving the baby's skin color a little yellowish tinge. In most instances, it is not a problem. There are actually some people feel that bilirubin actually protects the baby because it is an antioxidant. But at high levels that may be damaging to the brain, we may have to address this issue and lower the bilirubin level. So that if the bilirubin is of a mild or moderate level, there's really no reason to do anything because it will clear on its own. If it does present to be a problem, we have ways of addressing it and treating it.
There is a condition where the mother's blood, which could be O, and the baby's blood could be A or B. Is that a problem?
Potentially it could be a problem because the mother has natural antibodies against the baby's red cells. Antibodies are immune globulins that may actually attack the baby's red cell and cause them to break down a little faster, thus creating more bilirubin as part of the byproduct of the destruction of the red cell, and may cause a problem with the rapid rise of bilirubin. These are type of situations do require monitoring closely, and at times we may have to address the rising bilirubin by using various treatment modalities and lowering the bilirubin a little faster. That is definitely something that the pediatrician can very easily determine by doing a bilirubin level, monitoring the rate of rise of the bilirubin, and if necessary initiate therapy to protect the baby.
Also, when the kid goes home, the doctor watches the kid's blood because sometimes they get a little anemic.
Absolutely. Normally babies will get anemic usually between 6 weeks and 3 months because of the fact that they break down their fetal red cells. Obviously, if there is a process that facilitates or enhances that breakdown, the baby may become somewhat anemic faster and may require watching the baby and maybe adding some iron therapy to the baby, and in a rare situation the baby may even need a transfusion, but these are pretty rare conditions.
So generally it's watchable, and most of the time it doesn't lead to too much havoc.
In most instances the baby's natural processes and physiology will correct itself.